Hi, everyone, and welcome back to the Aesthetic and Wellness Edge. I'm your host, Bethany Gifford, and today we're diving into one of the most exciting areas in our industry, stem cells. First, a word from our sponsor.
This episode is brought to you by New Era Intel. At New Era Intel, we help medical spas, dermatology clinics, and plastic surgery practices who are struggling with inconsistent patient retention, underutilized CRM systems, and manual systems that hold back your clinic's growth potential so they can finally increase quality repeat bookings, streamline operations with AI automation, and grow predictable monthly revenue with the right systems and strategy. They're able to create a premium, seamless patient experience while freeing up their team to focus on what they do best. If you would like to take your business to the next level, head over to neweraintel.com to get started.
My guest today is Dave Elliott, the head of the Acorn Biolabs for partnerships and media. It's a company making stem cells banking simple and accessible for everybody. Acorn's work is changing how we think about aging, healing, and longevity. Dave, welcome to the show. I'm so glad that you're here today.
Well, thank you so much for having me. It's a pleasure.
Well, let's start with the basics because I know people are a little confused around stem cells. What is actually allowed in the United States and Canada and how we're banking them to begin with? Could you kind of give us a little insight?
Yes, of course. So the answer is not a lot, right? As of right now in Canada and the United States, the ability to use stem cells is very limited. So a lot of people think about collecting stem cells from the time of childbirth, right? You're collecting those stem cells, cord blood stem cells for specific use cases, and unfortunately, mostly in childhood cancers, right? So a lot of promise, but I would say not a ton of applications as of yet. The idea with stem cells, of course, is these are the building blocks of the body, right? Of your body. So they're uniquely matched to you, bioidentical. Think about it the same way you'd think about an organ, right? Your body is going to recognize a stem cell from you the same way it's going to recognize your own inner workings. And so the stem cells that we're collecting, the stem cells that you would collect, are holding great promise for future medicine in the area that you sell, which is regenerative medicine, using your own body to heal itself versus outside interventions such as metals, plastics, and medications. So we're just starting to see with a few sites in North America, the approval to use certain types of stem cells in research. And then we'll also see same-day application of those wonderful fat cells or adipocytes for aesthetic procedures. But the purpose behind Acorn is banking your stem cells now, stopping them from aging so that as these therapies become wider available to the general public, you now have a younger collection of those building blocks that you can deploy for different types of outcomes, be it in aesthetics, but also outside of aesthetics into athletics and even life-saving as well.
That is so fascinating. Oh my gosh. It's amazing how far we've come in science these days.
Well, I think we're about to go a lot further and a lot faster, I think, is what's coming down the pipeline now.
I feel like we're on hyperspeed in the past like 5 to 10 years. I'm super excited about it. You guys decided, for obvious reasons, not to do the bone marrow route, but instead hair follicles. Could you get into that a little bit and how that would proceed for one of our providers saying that they wanted to use?
Yeah, of course. So, outside of cord blood, right, you're able to get stem cells from all different areas of your body, right? Now, areas that we know of, right, are adipocytes, which I had mentioned, which are fat cells, right? And also from bone marrow. Now, both of those take a bit of work to get access to, right? And the average person may not be able to afford the procedure to collect the stem cells or have the ability to take that amount of time off, because both of those do require a surgical intervention of some sort. We decided at Acorn to focus on the hair follicle because what we really wanted to do is democratize access to stem cells. So find a way that the average person could collect and store their own stem cells without those drawbacks or limitations of a surgical procedure or the requiring of downtime. And so right in the base of the hair follicle, we're actually getting 4 types of cells. So it's a small but quite mighty package that's going to contain, mesenchymal stem cells, so the same stem cells that we're looking for from those invasive procedures. But, we're also talking aesthetics here. So you're able to access your keratinocytes, your fibroblasts, and your hair follicle stem cells. So as cheeky as it is to say, we like to kind of think about the hair follicle stem cells more of a full spectrum approach to collecting stem cells because of all of those different types that we get at the base of each hair follicle.
Ugh, that is so amazing. I mean, we could just do it straight in an office and not have any issues with our patients. No big
That's
needles, just a little boop.
There's very little pain to it, right? Now, for anyone who plucks hair, eyebrows or nose hairs, we know what it feels like, right? We are collecting them from the occipital region of the scalp, also known as the donor zone. That area gives us a really rich population of stem cells, and it's not super painful, right? Like I jokingly like to say for women, it's a 1 on the pain scale. For men, it's a 4, right? We don't do as many things that, we don't pluck as many things as we probably should to keep up appearances. The first couple of plucks for the average male are a little bit surprising, but after that, it is really just a swift pluck of hair follicles. That hair, of course, grows back, right? If it didn't grow back, there wouldn't be a waxing industry. So this is quite different when you think about an FUE from a transplant, because you're removing all of that surrounding tissue to transplant that hair follicle. Whereas for us, all we're doing is swiftly pulling it from the base of the strand to get that rich population of cells located at the base of the follicle.
Easy peasy. How long does it take to create? Like, how long should a clinic kind of plan for that? And what kind of spaced out treatment could they provide to their clients?
Yeah. So for us, obviously everything starts with the collection of the hair follicles, right? So once we collect those follicles, we have a proprietary vial of transportation media that we place the hair follicles in. Now, inside of that media, and we temperature control it. So we want to keep it fridge temperature of 32 to 38 degrees Fahrenheit. Sugars, salts, minerals, and antioxidants, right? So what we're doing is basically preserving the integrity of that hair follicle while we ship it back to our lab in Southern California. Now, when we get it to our lab in Southern California, we're doing 2 rounds of testing on it to make sure that those hair follicles are alive and viable. So we want to make sure that the entire inner and outer root sheath of the hair follicle is present, that there's no breaks or tears. And then we want to test a small subset of that population of follicles to make sure that that we have enough live cells. Once we know that, we're going to cryogenically freeze them. So that's negative 310 degrees Fahrenheit. So we have a lot of people that stop there and they say, I just want a biological health insurance policy, right? Once we move out of traditional medicine and we finish with precision medicine and we're knee deep in regenerative medicine, right? People just want to prepare for that future. And so people are collecting their stem cells from their hair, from umbilical cord, from wisdom teeth, right? People are preparing on multiple different fronts for that future. But of course, once you've got those stem cells collected, now we can move on to the fun stuff, which is creating those personalized products. Now, that personalized product is called a secretome, right? And so that is all of the secretions of your stem cells. So that's going to include your proteins, your growth factors, your matrix molecules, your exosomes, your cytokines. All of this material is powered by your own biology, right? So we like to say it's your own biology enhanced by us, right? And so we culture it for an extended period of time, right? You're looking at about 8 weeks from the moment we receive it to maximizing the yield of what we're able to get from those hair follicles, quality assuring it, lyophilizing it, so freeze drying it, and then returning it to a medical practice. We're looking at about 8 weeks end to end. And what you are receiving now as a practice is, for that patient, 12 vials of their own secretome, lyophilized, with 6 matching vials of non-phosphate hyaluronic acid. So anywhere that you would think to use PRP or an exosome product from a donor, you can now swap this in for that patient's own secretome, which we aptly named you.
That's perfect. I
We like
love
to
that.
get right to the point.
Yes, right to the point. So, for our aesthetic practitioners, what kind of procedures are we talking? Obviously, anything with PRP, microneedling, What, hair restoration, like after laser care? What does that look like?
I'm like, listen, you're hitting all the right markers. So you keep going. So yeah, we are against that category of cosmetic topical. So right now, we are using it for skin, hair, and scars, right? So microneedling it into the skin for skin texture, post ablative laser to reduce downtime, and of course, reintroduce all of those growth factors into the skin when it is exposed and ready for turnover. We're also using it for hair, right? So we're microneedling or stamping it into the hair. We're using Keralace devices and, other pressure devices like TED by Alma. And then we also have practitioners using it at the time of surgery to help, reinfuse high volumes of a patient's own fibronectin to allow those collagen fibers to lay properly, of course, with the goal of mitigating scarring.
Wow. That just expanded a whole new field of there for all our plastics out there. That's great.
I mean, it's the thing, right? They're artists, right?
Yes.
And so anything that you can do to boost that outcome is, for them is very exciting. And I say the same thing to a hair restoration specialist, right? I said, like a hair transplant with you is like buying an iPhone, right? Best on the market. Sorry, Android users, right? I said, but even though you have this superior product, of course, you're going to pay $8 a month to get Apple Care, right? And to me, when you've done this work creating, a beautiful new hairline, why wouldn't you buy the Apple insurance that can ensure that that work can stand the test of time by reintroducing at the time of need those healthy signals to stimulate hair growth?
Wow. That's incredible. Um, I guess my question would be like, who is like the ideal, secretome client and how would you kind of like set expectations for that patient, like from a provider's perspective?
Yeah. So, I mean, listen, if I take my sales hat off, I'll say everyone is an ideal secretome client, right? Everyone gets scratches, nicks, maybe a little bit of hair loss here and there, right? If we're not wearing our sunscreen all of the time, we can end up with sunspots. So, who doesn't want to target or improve skin texture? Or hair span, right? Increase the amount of time that you have your hair in that optimal phase. But really, when I sort of boil it down, there's a couple of demographics that I think are perfectly aligned. So a traditional aesthetic patient, right, who has very specific goals, who is using regenerative treatments already, right? If we're using rejuvenation treatments such as baby Botox, right now is a perfect time to collect your stem cells, but maybe you don't need the secretome just yet, right?
Mm.
Now, for those of us who've had a few extra laps around the sun, with your sunscreen or without, right, we're going to start to see, a loss in skin volume, maybe, a decrease in the quality of skin texture. We're going to start to see sunspots. We'll start to see, the hair not at its healthiest. Those people right there who are already doing things like PRP or an exosome product, right? This is the perfect patient to introduce this to, is unfortunately, as we know with PRP, at certain time points in age, it becomes a little bit less effective than it maybe once was. Plus, we are asking the patient, and this is always the worst nightmare, to hydrate, to eat well, to sleep well, right? How many times we have a patient that comes in for their PRP treatment and they've, slept for 4 hours and they went out the night before and they had a couple of drinks, right? All of those are going to impact the quality of your PRP, whereas our intake protocol for collecting the hair follicles ensures that we have a best-in-class starting material and that the cell count is high enough that we know we can create a really consistent product, right? We also know that, bless their souls, people want to do one microneedling treatment and see a massive overhaul in their skin, which is not necessarily the reality, of course. And so the idea of having 12 treatments that have been created that you can now map out for an entire year of treatment or, a hair protocol, it's very exciting for someone who's looking for a long-term solution, because from that collection of hair follicles, you can actually make multiple rounds of the secretome product.
All right, let's talk a little bit about the business side of things. How should a clinic maybe price or package the secretome treatments? How could they kind of fit it into like a membership or a yearly plan? What are some of your suggestions?
My goodness, you are speaking my language. Anyone who has a high-end membership for their patients, Acorn is an absolute no-brainer, right? It is from the point of a practitioner, right? It's very sticky product because once you've collected the stem cells, you've taken that first sort of leap into regenerative medicine with that patient together, right? So you sort of establishing yourself, I would say, as an opinion leader in that space where that patient is concerned. And then, of course, once you've created the secretome, now you have 12 little vials that you can use for different outcomes, right? So you might use 2 at a time to stamp into your hair, right? If you do just a microneedling treatment, you might use 1 vial. If you do a highly ablative laser, you may do 4 vials and then take a couple of vials home because we do provide modalities to be able to take that product home. Now, it only works if your skin is stressed. So that's quite specifically why I mentioned CO2 or anything in the highly ablative family of lasers, right? No matter what you put on top of your skin, you'll still see some distressing in the following days. So it really depends, right? So both sides of this are a revenue generating activity, right? So collecting the collecting the samples using one of our kits is something that you would charge for. So our MSRP for that is $950. And that can be done by anyone in the practice. It's not considered a medical procedure. So if you have, an MA who's looking to cut their teeth and take on something on behalf of the practice, it's a great way to give them a lane in which they're able to sort of master that conversation and sell stem cell collections. Now, I will also say, if you have somebody who comes in for a stem cell collection, let's say the husband, right? If they come home and they say to the wife and the kids, I just went home and collected the stem cells, so I preserved a portion of me indefinitely, unless they bring the wife and the kids back in, they're probably going to be sleeping on the couch for a little while, right? Because you took this sort of, I've preserved my own youngest cells that preserving yours. So we do find that there's also like a high risk for people who have gotten banked to bring in additional members of their family. Now, the secretome side of things is really where you can sort of play around a little bit, right? And so because you're getting those 12 vials, right, you are able to charge sort of a base price as a regenerative booster pack, right? Just to cover the costs and, multiply the margins a couple of times to make sure you're covered. So you have already recouped all of your spend just by charging for the collection and for that little booster pack of vials. Now, when someone does that, what they will typically do is create either like add-on package or a full protocol, because you do have to do microneedling and lasers still to apply the product, right? So I can sell it to you part and parcel by saying, here's your regenerative booster pack, and then we can schedule out your treatments over the course of the next 18 months, because that's how long that product lasts in the fridge once authorized. So 18 months worth of treatment mapping, or you can just say to someone, this is going to be the year of hair. Now, obviously, Bethany, you don't need that. But, they could say, we're going to do, 2 vials every 2 months, and we're going to stamp it in. And you can, again, set the price for it, right? Now, you could tell I'm being a little bit sheepish, and that's because it really depends on your practice. It depends on your demographic. And ultimately, it depends on your area, right? So, when you jump from 90210 to 90211, there is a tiny little price difference, right? Because with anything, you're not just paying for the product, you're paying for the experience of a practitioner who is applying that product, right? And it can sometimes be tempting to go with, the options that maybe cost a little bit less, but at the end of the day, you are having, you're banking on the experience of that practitioner to maximize the outcome of that product.
That's amazing. Gosh. How should the team handle inventory and reordering? Do you send all the vials out at once? Do they keep it in the fridge? What does that look like?
Yeah, so it's pretty low touch, right? Like the what we require are we have little vials of media, right? Small but mighty vials of media, and they're paired with a customer's information card. So we just need space in the fridge for those, right? So it's about this big, nothing huge, right? That's 10 right there. And then we have the collection kits, and the collection kits, for those of us who remember them, are about the size of a VHS, maybe a little bit stubbier, but those contain all of the tools, and those tools are autoclave, and they're only one-time use that you use to actually extract the hair follicles. And so those can sit in a cupboard. ready to be used. And then we also, depending on the volume of your practice, how many samples you're doing, we stock you with a portable button activated cooler called the NanoCool. And so those are how we are able to ship those samples on demand. They're pre-labeled to ship to our office in Southern California, no matter where you are in the United States. Canada, we ship everything to Toronto. But ultimately, those NanoCools, again, sit in the cupboard somewhere. You flip them open, you push the button on the underside, it cools within 15 minutes. You place that biological sample inside. We send FedEx to pick it up. And as long as it's picked up before the express cutoff, we actually pop it in our labs the next morning by 10:30, right? Because we are dealing with biologics and it is a law of diminishing returns. So we want to get that cell sample back to us as quickly as possible so that we could process it, test it, and then cryogenically freeze it, so stopping it from aging. Now, when it comes to the secretome, right, those are a smaller, narrow box, right? It has the patient's name right on the side of it. So you keep those stored, same thing, in the fridge. We have practices that are just getting involved, and so they're sort of storing it in a fridge with, their Botox, sharing a bit of fridge space. But then when we get to super users, right, people that are using this for all of their patients, and we do have quite a few of those, now we're talking about a specific fridge to store those materials in. And when it gets even larger, we have a practice that we want to dedicate an entire room to storing secretome, because we want this to be sort of the linchpin of all of our regenerative aesthetics.
That is so amazing. This is so fascinating. I am obsessed with all these new treatments and stem cells, of course, when we first started hearing about that way back in the day. Who knew? Who knew we could put it on our skin? I love it. So fun.
Yeah, right. We're going to, listen, I've got no beef with PRP and I've got no beef with exosomes. I use them both, right? But now what we're talking about is a one-to-one product. So using something from yourself, right? And we're also talking about a product that's derived from your own skin and hair, right? So we're getting those healing signals from the skin and hair. Now, I think we talked about this before, but I love, love, love this piece, and I'm not sure we would touch on it, but when we are culturing out this secretome, because of how long we culture it for, the starting age of the cells don't matter near as much as they would with something like PRP, right? So, one of our slogans is save your cells from aging, and everyone has a different perception of what is old, right? At what time are their cells no longer valuable? But at the end of the day, your cells are uniquely matched to you. Nobody else can crack that code, right? So even though, you may be a little bit, you may have seen even more laps around the sun than we have, right? We have lots of patients into their 60s, 70s, and even 80s that are banking their stem cells just for the promise of what possibly could come, right? And when we look at that secretome product, because we are actually treating your hair follicles like little factories to grow growth factors, to secrete matrix molecules and exosomes, versus PRP, where we're taking blood and spinning it down to what's inside, we're actually able to multiply those folds higher and higher over PRP with, some of those growth factors and matrix molecules even being at volumes at 34 times as high as you would find in a patient's own PRP. And when we have done the proteomics testing, I would say our oldest patient who got his stem cells collected, the age of 83, right? Hoping to be able to play golf when he was 93. We ended up using it. He ended up purchasing it when he was, I think, 87. And so we said, let's take one vial and see what's inside, right? And the difference when we compare it to an average 30-year-old is only about 15%. Now, it's exactly what you expect it's going to be, right? It's going to be your collagens. It's going to be your hyaluronic acid. It's going to be your fibronectins. But even when you look at those numbers and you go 2, 3, 4, 5, 6, any amplification of those healing signals is going to be really beneficial, whether it's in aesthetics or it's in wound care, right? Right now we're topical application, but you can bet your bottom dollar that we're, exploring how to be able to inject this same product. And we will then do that for aesthetics, but also into athletics and orthopedics, and even into fertility, right? So we are endeavoring to be the first fully compliant stem cell company in North America, right? It's sometimes not the easiest, right? There's lots of corners to be cut, but we are, we are the safekeepers of patient stem cells. We take that very, very seriously, right? We have been HIPAA compliant long before we had to be. And so we want to go the absolute safest and most appropriate route to be able to test these products and work in lockstep ultimately with the governing bodies who are deciding what is and what is not approved. So we're cozying up to our friends, and we are being very transparent in the work that we're doing, and we're hoping for a swift outcome.
Absolutely. Well, I am ready to sign up for all of the extra research you guys are coming in for, not just the current, but I am watching you guys closely, and I really hope to be a part of your journey and be able to just be like, I remember them when.
I'm just looking for a reason to come to Tennessee. So y'all just let me know. I've already practiced my y'all. I'm ready to go, right? I mean, even outside of those applications, if you've got a minute, we can chat about, future applications,
I'd
right?
love to hear what's on the horizon for you guys.
I'm talking about life saving, and I haven't mentioned a single thing except for saving the lifespan of your hair, right? We have research projects in place where we're taking this rich assortment of cells and we're turning them into bone cells, fat cells, cartilage cells, pancreatic progenitor cells, right? With the hope of being able to contribute towards a quantifiable cure for type 1 diabetes, right? We've been able to make dopaminergic neurons, which are the neurons responsible for Parkinson's disease, right? We can make an autologous version of that powered by a patient's own biology. And then most recently with the National Research Council, we've actually created natural killer cells, right? Which are the type of cells that kill disease within the body. And so we are using those cells in research for the big C, right? We want to see what we can do to impact cancer research, right? How we can contribute towards increasing people's lifespans by being able to, mitigate some of the world's worst diseases using all of the signals that your own body is able to create.
Well, Dave, this conversation has been absolutely eye-opening. I love how Acorn is bringing science and accessibility, together, not just for aesthetics, for regenerative medicine and for real patients and practices alike. So thank you so much. I know all of our practitioners and our estheticians and surgeons and beyond are going to absolutely love this episode. So thank you so much. For anybody listening, how can they get a hold of you? How can they apply this to their practice and ask you much more questions? Because I know they're going to have some.
Yeah, no, that'd be fantastic. Reach out to me directly. So Dave at acorn.me. So ACORN.me is the perfect way. I will make sure that I introduce them to the person who represents that portion of the country. So they've got the most direct line to someone that can help them understand how this will benefit their practice and get working on integrating it, because this is not a future you want to get left behind on. I'll tell you that much.
You've heard it here, folks. Get a hold of Dave for sure to implement this into your practice ASAP. For everybody tuning in to the Aesthetic and Wellness Edge, thank you so much, and we look forward to seeing you on the next show.